Now we're going to discuss about the first step of an outbreak investigation, identifying cases. When we investigate an outbreak, the questions we have are the same questions a good journalist would have when they're writing a story about some event. We want to know who's involved, what's responsible, when it's occurring, where it's occurring, and why it's occurring. These questions correspond directly to the stages of an outbreak investigation. We first want to establish a case definition and identify cases. In other words, answer the who is involved in the outbreak. We then want to obtain information on the time, place, and person of the people involved in the outbreak. That is when and where it's happening. We then want to identify and characterize the pathogen, what's responsible for the outbreak. Perform a risk factor study to understand why the outbreak is occurring. And finally, we want to intervene and report. That is, take action to counter the outbreak. So the first step in an outbreak investigation is to define who is part of the outbreak and identify cases. And the basis of doing this is the case definition. So a good case definition identifies people involved in the outbreak by person, place, and time. For example, the WHO case definition for cholera says in an area where the disease is not known to be present, a patient aged 5 years or more who develops severe dehydration or dies from acute watery diarrhea is a probable cholera case. And in an area where there is a cholera epidemic, a patient aged 5 years or more develops acute watery diarrhea with or without vomiting is a probable cholera case. But in individual outbreaks, we would narrow that case definition to define things more specifically by person, place, and time. For instance, in a particular outbreak, we might say Rumonge residents of at least 5 years of age who were admitted to a hospital for acute watery diarrhea with onset of illness between April 30th and May 2nd, 1992 were cases. Notice here we're being specific about the place where the outbreak is occurring, who could be considered a case, and the time in which it's happening. So usually when we make a case definition, we define different types of cases based on our confidence that they're actually a case involved in the outbreak. So a suspected case would be a person for whom there's suspicion of disease but no strong evidence or laboratory confirmation. And often suspected cases will trigger further investigation. A probable case would be a suspected case for whom there is strong circumstantial evidence for infection, for instance, exposure to a known case. And finally, a confirmed case is a person for whom there is definitive clinical or laboratory confirmation that they are a case, so for whom we do some test to confirm that they're infected with the pathogen. To illustrate case definitions, we'll use the example of an outbreak of monkeypox that occurred among children exposed to prairie dogs in Indiana in 2003. So here, a monkeypox virus was transmitted from ill prairie dogs in a childcare and veterinary facilities, and most cases of monkeypox seen in that area were associated with the direct animal contact. The investigators defined 3 types of cases. The suspected case was a patient with known prairie dog exposure with fever or unexplained rash and 2 or more of chills, lymphadenopathy, headache, sore throat, cough, dyspnea, or myalgia within 21 days of exposure. Probable case was a patient with known prairie dog exposure with fever or vesicupustular rash within 21 days of exposure. And a confirmed case was a suspect or probable monkeypox infection with laboratory confirmation of illness by either viral isolation and culture or PCR. So once a case definition is established, we need to go out and actually find those cases in the community. And we do that through either active or passive surveillance. For active surveillance, we go into the community and actually look for cases. So for instance, we might directly contact healthcare providers or perform a house-to-house survey. In passive surveillance, we look for cases that present at healthcare centers or other areas passively. So we may simply ask hospitals or doctors to report cases that come into their facilities. Investigators should carefully assess where to look for cases based on what they think the likely etiology, or rather cause, of an outbreak is, and where they think people might be at risk. So for instance, in this monkeypox infection, we'd have to decide, where do we look for monkeypox cases? Should we look across the entire country, the state, the county, just at childcare center attendees, or just at pet supplier customers? So here we're trying to balance making sure we catch all the cases that are relevant with making sure we don't conduct an investigation that's too wide and covers too big of an area to actually be practical. So some key points from this section. First, establishing a case definition is the first step to identifying cases in an outbreak. A good case definition should specify cases by person, place, and time. Our case definition will represent different levels of confidence that individuals are cases. Usually we divide into suspect cases, probable cases, and confirmed cases. Careful consideration should be given to where and how to look for additional cases. And case definitions and study populations may change as an outbreak evolves. So to practice the skills in this outbreak, you should look at the following list of cases. Make a definition for suspected, probable, and confirmed cases for the following outbreak.